Jen. I am Jen. I am here to help you pass any medical coding certification exam.
Question. With the patient under local anesthesia, my provider made a small incision in the patient's skin. They inserted the intracatheter into an artery and guided it to the area of focus. How should I report this?
To find the correct CPT code for this procedure, follow these steps. Step 1. Open the AMA CPT book to the table of contents. The AMA CPT book has a table of contents that lists different sections of procedures. Since this procedure involves an incision, insertion of a catheter, and guidance to an artery, you will likely be looking for codes related to vascular access or catheter placement. Step 2. Locate the cardiovascular section in the table of contents. Find the cardiovascular section, which typically covers procedures related to arteries, veins, and the heart. The codes in this section are usually numbered in the 30,000 range. You'll likely find the right subsection for vascular access here. Step 3. Narrow down the area of focus. Now that you know you are looking for the vascular access codes, you should focus on the area of artery catheterization. These procedures are often performed using fluoroscopy or other imaging techniques, so make sure you look for any subcategories that mention these techniques or similar actions. Step 4. Look for the intracatheter placement code within the vascular section. Look for codes related to the insertion of a catheter. You're specifically looking for something that involves insertion into an artery vascular, guiding the catheter to a specific location, local anesthesia, which is typically not separately reported unless it's a significant service. Step 5. Check for additional guidance or imaging. Some codes will be based on whether fluoroscopic guidance or other imaging methods were used to guide the catheter into the artery. Make sure to verify whether the provider used any imaging to guide the catheter, as that could affect the specific CPT code. Step 6. Verify the code with documentation. Once you've identified a potential code, check the description to make sure it accurately describes the procedure performed. The correct code will typically describe the incision, insertion of the catheter, and the guidance of the catheter into the artery. If you're uncertain, the CPT index at the back of the CPT book can also help you. Look up terms like catheter, vascular, or artery to locate related codes. The correct CPT code for the procedure you described would be 36,140. Here's the breakdown. 36,140, introduction of needle or intracatheter, upper or lower extremity artery. This code is used for the procedure where a small incision is made and a catheter or needle is introduced into the artery, typically in the extremities. It specifically covers the catheter insertion and the guidance into the artery, which aligns with your description. Remember, this code applies when the procedure involves insertion into an upper or lower extremity artery under local anesthesia. If any imaging guidance like fluoroscopy was used, you might need to look for additional codes or modifiers related to intracatheter defined. An intracatheter is a plastic tube attached to a needle. Your provider will remove the needle once the catheter is in place. An intracatheter is used to instill medications, fluids, and contrast material, and may also be used to monitor pressure in an artery. Coding tip: never report 36,140 in conjunction with percutaneous arteriovenous fistula creation, codes 36,836 or 36,837